The so-called mystery dog illness may not be such a mystery after all. Stay with me till the end because I'll reveal an effective new home remedy. If you're interested in natural pet health and wellness, you're in the right place. Click the link to subscribe to Veterinary Secret. Recently, a serious respiratory disease has affected thousands of dogs across North America. Initially, it looked like typical kennel cough, but veterinarians started calling it atypical kennel cough. Many dogs quickly became severely ill, developing pneumonia and not responding to standard treatment. Some even required oxygen support, and sadly some passed away. There's been a lot of media coverage on this issue, and I've already done 2 videos about it. Now, however, many experts and veterinarians believe this illness might not be such a mystery. They're still calling it atypical kennel cough, but they think it could have multiple causes like Bordetella para-influenza or mycoplasma. While the outbreak is serious, most specialists don't believe it's caused by a brand new infectious agent. The situation may be the result of multiple factors. During the COVID pandemic, a large number of people adopted new dogs. Add to that the presence of respiratory pathogens, colder fall and winter months, and more dogs confined in smaller spaces. This creates the perfect conditions for the spread of respiratory illness. In many cases, the illness could be caused by the same pathogens responsible for kennel cough, but what's hard to explain is how a young healthy dog can go from having a mild chronic cough to developing severe acute pneumonia within days, completely unresponsive to conventional treatments, even requiring oxygen, and in some cases dying. Some case reports from referring veterinarians don't fully support the theory of known pathogens being the only cause. Many referral centers, especially veterinary colleges, tested severely ill dogs to identify the pathogens responsible. In many cases, no respiratory pathogen was found even though the dogs were seriously sick and not responding to drugs like doxycycline. I came across an article comparing this outbreak to the first time a major new disease affected dogs in veterinary medicine. Back in the early 1980s, a disease called parvovirus emerged. When it first appeared, most dogs had no immunity because it came from a viral mutation. They had never been exposed to it before. As a result, hundreds of dogs were infected and many of them died because there was no effective treatment or prevention available. Experts argue that if today's illness were caused by a brand new unknown pathogen, we would be seeing thousands upon thousands of cases with no way to stop the spread. A massive outbreak would be unavoidable. However, the reality might be different. Many dog owners are now more cautious. People are avoiding crowded dog parks, and if their dogs show any signs of coughing, they're keeping them at home. It's possible that these preventive behaviors have helped reduce the spread. So what should you take away from this? First, it seems like the number of cases is now decreasing. There are fewer reports and overall concern is lower. Many veterinarians are now successfully treating dogs that develop symptoms, which is a hopeful sign. In cases that progress to acute pneumonia, an older veterinary drug called chloramphenicol has shown to be quite effective for many dogs. Personally, I still think it's smart to be cautious. I haven't taken Tula to the dog park yet, and I don't plan to until at least spring. Most dogs that develop a cough are likely dealing with something like kennel cough, commonly caused by pathogens like Bordetella. But if your dog suddenly develops a cough like if Tula, who has no history of coughing, started tomorrow, I'd immediately begin using some natural home remedies. Let me show you 3 of the best options I'd use. First is the green tea cough syrup. It includes green tea, raw honey, slippery elm, and licorice root. Take 1 cup of green tea steeped for 20 minutes. Add 1 tablespoon of unpasteurized honey. Then add 2 capsules or 800 milligrams of slippery elm, which is excellent for cough relief. Finally, add 2 milliliters of licorice root tincture, known for its antiviral and antibacterial properties and effectiveness against respiratory issues in dogs. Mix the syrup well and give your dog 1 tablespoon per 10 pounds of body weight twice daily. It's a powerful homemade remedy for respiratory illness. The second remedy is quercetin. It's a medicinal flavonoid found in apple peels and red onions and is well documented for its health benefits. Quercetin has shown great potential for treating viral respiratory diseases, and it also has strong antibacterial effect. There's a specific bioavailable whole plant extract form available, and the typical dog dosage is 50 mg per 15 pounds of body weight daily. The third natural remedy is propolis, also known as bee glue. Bees use it to strengthen and seal their hives. Propolis contains various medicinal compounds and has been widely studied. Recent research suggests it's especially helpful for dogs with respiratory illnesses due to its antibacterial, antiviral, and anti-inflammatory properties. It can help reduce inflammation and open damaged airways. If my dog had this mysterious respiratory condition, I would definitely be giving her propolis. It's very safe with little to no side effects. The standard dose is 100 mg per 10 pounds of body weight daily. So for a 25-pound dog like Tula, that's about half of a 500 mg capsule each day. Now, should you still be worried about this mystery dog illness? In my opinion, yes, but less so than a month ago. We've seen progress, and as more information becomes available, I'll be sure to keep you updated. Click the link above to subscribe, hit the bell for notifications, and check the description below to get a free copy of my book.